insulin and diet to manage her blood sugars? A, you know what? I don't like the way this looks. This looks like a 0. It does look like a 0, but it's not. All right. A, 024.414 Z3A29. B, 024.415 Z79.4, Z79.84, Z3A.29. C, 024.414 Z79.4, Z3A.29, and D, 024.419, Z79.4, Z79.84, and Z3A.29. Coders, do you all see something? Type in the chat. What do you see? What do you see in the answers? That's why we read the answers first, so it can give us some information, right? Anybody notice something in the answers? Somebody's answering the question. Don't answer the question yet. I want to know what you see. All right, so maybe you don't see it yet, but you will. But all of these have subcategory 4, 024.4. That means this is a gestational diabetes scenario. A 25-year-old OB patient with gestational diabetes and 29 weeks pregnant arrives for a routine prenatal visit. The patient's blood sugars are normal. The patient uses insulin and diet to manage her blood sugars. Okay, coders, somebody coded it straight away. They said, we don't know what you're talking about, Mrs. J. The answer is what? Say you. I guess my little clock doesn't want to work. It's okay. Go ahead, put your answers in the chat. All right, make sure you go grab the guideline. What's the guideline? That's right. Somebody said, I'm about to look at it. I know that's right. Well, let me see. I wish I could see the full. You all are saying some great things, but I can't see everything. If you make short comments, I can see it, but not long ones. So I do apologize for that. All right, so grab your guideline. Tell me which guideline you referenced. Yes, yes, yes. Good job, good job, good job. All right, so the guideline is going to come up on the next page, but our keywords: gestational diabetes, 29 weeks, insulin, and diet. And we know this is gestational diabetes because we just studied how to identify them. And we're going to code for gestational diabetes, and this patient's on insulin and diet, not oral hypoglycemics. I got caught. Let's go back. I want to make sure it's on there. Nope. All right. So, guideline C4A4, it's the same as that C15.I. Yeah, we're going to reference the guidelines for gestational diabetes. All right. So there's some key language in there, and it tells you, it outlines if a patient is on, if it tells you which code to select if the patient has gestational diabetes and their diabetes is being managed using insulin, diet, medications, etc. So this language here kind of helps us determine how to sequence things. And so when you have gestational diabetes, I further clarified the MCG manual. So if you have an MCG manual, you don't have the green language. I suggest that you put it in because I think it clarifies it a little more. Here's why. If you have insulin, you use code 024.414. Or if the patient's um, diabetes is controlled by diet and insulin, you use that same code. The same is true for oral hypoglycemics or diet and oral hypoglycemics. They use the same code. So I got that from this language in the middle. So they don't really code when a patient is using both, they code the higher of the two when it comes to diet and insulin or diet and hypoglycemics. So if you want to change your language, go right ahead. So knowing this language, it gives us an advantage, right? Sort of, right? Well, if you look below where it says codes Z79.4, that's your insulin, Z79.84, and Z79.85 should not be used with a code from 024.4. Make sure you put the point 4 there. You do not code insulin in addition to this subcategory. Don't do it. Go ahead and write it in point 4, that subcategory. We're nailing this today. All right. So if that's the truth, we got a lot of wrong answers here. Look at B. B is wrong. It's coding Z79.4 with this 024.4 subcategory. It's also coding Z79.84. You cannot do it. The guideline says you can't. Look at C, wrong too. It's coding the insulin with that subcategory, and so too is D. So look at your answer. But A is the answer, but let's go ahead and do our due diligence, right? Yeah, let's take a look. Let's put our eyes on these codes. So if we go to 024 subcategory, 0241, and if you look at 024.415B, this is the code for gestational diabetes mellitus in pregnancy, controlled by oral hypoglycemics. This is not pertinent to our encounter. Our patient's taking insulin. So B gotta go. 024.49 found that D, gestational diabetes mellitus in pregnancy, unspecified control. Nope, we know how this diabetes is being controlled. Our documentation says it's being controlled by use of insulin. So D is incorrect as well. Now, 024.414, this is correct. Gestational diabetes mellitus in pregnancy, insulin controlled, so we can use it. So the biggest point that I want to make, if a patient is using insulin along with diet, you only code the insulin code. And I do want to point out that there is a diet controlled code too, 024.410, but you only use it if the diabetes is being managed by diet only. So B has to go, D has to go, C's going, and our answer is A, 024.4, Z3A.29. Okay, coders, how you doing? You doing good? Yes. I saw all those A's in there. I was so happy. You know what? I don't think I can see your answers anymore. All right. Good job, coders. Let's go ahead and let's knock this next one out. Got another pregnancy. A 30-year-old, 11 weeks pregnant patient. Oh, no, 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 sorry. Forgive me. Select the correct answer. A, 024.414, Z3A.11. B, 024.111, E11.9, Z79.4, Z38.11, C, 024.112, E11.9, Z79.4, Z3A.11, and D, 024.414, E11.9, Z79.4, Z3A.11. A 30-year-old, 11 weeks pregnant patient who has diabetes mellitus arrives for a routine prenatal visit. The patient's blood sugars are normal. The patient uses insulin to control the diabetes. Select the correct answer. Okay, coders, what say you? Your time begins now. Okay, coders, I think this is going to be an aha moment for a lot of people. Yeah, I don't see too many answers in here. A lot of people stumped saying, hey, I don't know if that's gestational or pre-existing, right? All right, so this is 11 weeks pregnant patient. Patient has diabetes mellitus. Patient uses insulin. Coders, this is pre-existing. If it was gestational, the documentation will say gestational diabetes. It will indicate that the pregnancy caused the diabetes. All right, so just so you know, the documentation has to specifically say that it is gestational diabetes or the pregnancy caused the diabetes. All right. And in that case, this is pre existing diabetes. In other words, this diabetes pre existed prior to the pregnancy, and we're going to use C4A.4. Someone said it in the chat. You rock. And we're going to sequence in the following way. We're going to sequence first 024.1, followed by your diabetes code, and third, your insulin code if applicable. Coders, can we eliminate anything on site? In fact, we can, right? We can eliminate what? On site. On site, we can eliminate A and D because look at that 4. Look at that pregnant gestational 4. This insulin existed, this insulin, this diabetes mellitus existed first before the pregnancy. I got a new thing. That one means first. That one in the subcategory section means first. This is applicable to our scenario. So we are going to get rid of A and D because this is not pre-existing. This is not gestational diabetes mellitus. All right, so it leaves us with B and C. So the guideline that I'm going to use is that C4A4 just applies all the way around. And there's no way we can tell the correct code based upon the guidelines, so we have to look up the code. Let's go ahead and do it. All right. 0241 category. This is pre-existing type 2, diabetes mellitus in pregnancy, childbirth, and the puerperium. Also, the second code is our diabetes type 2, not specific. Also, the third is Z79.4. This is our long-term use insulin. And you know what we need to know? We need to know the trimester. We need to know which trimester we're in. Why? Because the code at 2411 subcategory 111 is for first trimester, and 112 is for the second trimester. And we have to know the trimesters according to ICD-10-CM. So the ICD-10-CM trimesters. And it says the first trimester is less than 14 weeks, 0 days. So this patient is in her first trimester. So we're going to use the first trimester code, 024.111. So we're going to eliminate C. And our answer is B. How you doing, coders? I see some aha moments going on in the chat. Somebody said, they're fine. That's right. Good deal. Somebody said, I'm great. Somebody said, I'm okay. Hey, I got you. I got you. And you know what? You can always look at these playbacks. So definitely make good use of them. All right. So now we're going to leave our discussion on um, diabetes and pregnancy. And I want you to just remember that pre-existing means that diabetes existed first or prior to the pregnancy. Gestational is caused by the pregnancy or the gestation. And you're going to sequence your pre-existing like this. 024.1, 1 in the fourth character space means first. And you're also going to code for your type of diabetes. You're going to code for your insulin if applicable, and also your week's gestation. Whereas gestational diabetes, you use 024.4 subcategory. And remember, I'm going to let that marinate. All right, coders, are you ready to continue our discussion? Let's learn about some more guidelines. Oh, yeah, someone has a good point. They said, hey, if gestation isn't documented, if gestation is not documented, you are correct. Then it is pre-existing. Okay. All righty. Question number 5. Select the correct answer. A, E10.9, Z79.4. B, E11.9, Z79.4. C, E11.9, Z79.4, Z79.85, and D, E11.9, Z79.85. A 36-year-old male patient visits the clinic for a routine follow-up appointment for his diabetes mellitus. He has been managing his condition with both Lantus, 20 units subcutaneously daily, and Trulicity, 0.75 milligrams subcutaneously weekly. All right, coders, what say you? Your time begins now. All right, coders. I think a lot of these guidelines seem to be jumbled. I can tell because you all are applying guidelines for certain circumstances. So, my advice, don't try and commit that to memory. Grab your guideline and apply your guideline and follow that guideline until you know it, right? You all are rocking and rolling. Good job. All right, I'm going to wait for a few more people to put their answers in the chat. Make an educated guess based upon the guidelines. Good job. Good job. Good job. All right, coders. All right. So this patient has diabetes mellitus, right? And they're taking this Lantus and they're also taking Trulicity. But coders, when the documentation says that the patient has diabetes mellitus, what type is it? What is the default? Go ahead, type in the chat. Yeah, it's type 2. So if the doctor doesn't specify type 1, you do not document type 1. All right, just thought I would tell you that. All right, so just so you know, one of the guidelines I'm going to reference is C4.A3. But I realize that you all may not be able to determine if insulin is being used or not. Is Trulicity insulin? Is Lantus insulin? Okay, well, let's address that. But before I do that, I just want to let you know that Lantus is insulin and Trulicity is not insulin. It's an injectable, but it's a non-insulin injectable. Well, how do you know that, Mrs. J? Well, I did some research and I looked up the common insulin brands. Yeah. And so they're kind of, you have different insulins for different purposes. So you have this rapid acting, acting, intermediate acting, long acting insulin mixtures. It doesn't matter. What matters is that you're able to identify if insulin is being used or not. So I looked at this list and I said, okay, how am I going to get them to recognize insulin? How are they going to identify insulin on site? Well, you see these logs, Humalog, Admalog, Novolog, right? And you see these lins, Humulin, Novolin, right? And then you've got Humulin, Novolin, Humalog, Novolog. So you got these logs where the suffix is a log or lin, then it's 9 times out of 10 in insulin. And then you have all the others in between, but it's not a lot. You have the Mojav, Apidra, Afreza, Levemir, Lantus, Basaglar, Tojo, Semglee, Traceba. And you know what I did? I wrote them right here. Here you go. Here are your common insulins. It's going to end with a log or a lin, or all these others here on the list. That's the best I can do, coders. It's not that big either, right? So if you want to screenshot it, go ahead, boom. If you want to wait for the playback, it'll be there. Okay? So that's what I recommend that you do. Put that in your book. Well, I will put it in the MCG manual, then go ahead and put it in when you tap it in your book. Just saying. All right, so guideline C4A3 is applicable. And so is C4A2. Now let's get to it. All right. So let's look at guidelines C4A2. When the type of diabetes mellitus is not documented, you code it as type 2, right? E11.6. So we're eliminating A because A is E10.9. That's type 1. Also, when you have insulin and oral hypoglycemics and non-insulin injections, you have to code it a certain way. And the coding instruction is at C4A3. And if you go over to the third column, it says when the patient's treated with insulin and injectable, a non-insulin injectable, that's Trulicity. And also two coders, see where it says subcutaneously? That means they are injecting it into the skin and down to the subcutaneous level, right? So we know Lantus was on our list. That's insulin. And Trulicity is not on the list. So it's got to be a non-insulin injectable. So how we code it, we have to code Z79.4 for the insulin and Z79.85. And just so you know, coders, when you are coding regular diabetes type 2, you code everything. If a patient has oral hypoglycemics, non-insulin injections, and insulin, you code it all. And that's when they have diabetes type 2. And we're not talking about pregnancy, all right? So we're going to eliminate A because it's coding for the wrong type. We're going to eliminate B because they're not coding for the Trulicity. They're only coding for the insulin. We're going to eliminate D because it's only coding for the non-insulin injectable Trulicity. And C is our answer. How are you, coders? You all kind of quiet. I need to know how you're doing. All right, somebody said okay. Somebody said great. Somebody else said great. Somebody said good. Somebody said I got it now. Awesome. Somebody said I'm learning. Priceless. Okay. All right. So it's just a matter of you just looking at the guidelines and just looking at them more than once, and it's going to make sense.
Thanks for tuning in, and until next time, happy coding!